community of practice that myself, Dr. Catherine Cullerton and Dr. Victoria Loblay, we co-chair this community of practice. And it's a fairly informal affair. We have a presentation, and then there's an opportunity for questions and answers for everyone. And the whole purpose of this is so that we can all learn as qualitative researchers how to do a better job and to get inspired by other researchers doing amazing work in this space. So before we go any further, I'd like to acknowledge the traditional owners of the lands on which we're meeting, wherever we are around Australia. I'm on holidays, and so I'm on Yugambeh country on the Gold Coast, but welcome wherever you are. So we're really fortunate today. We've got two amazing speakers. One of them I know well. We've got Dr. Victoria Loblay, who is the co-chair of this community of practice, and she is from the University of Sydney and works in the Brain and Mind Centre. And then we've also got Dr. Abby Haynes, who is also from the University of Sydney in the Institute for Musculoskeletal Health. And they're actually going to be doing a joint presentation for us today on the limitations of barriers and enablers approaches in qualitative research. And I'm really looking forward to this because I have to admit I have done barriers and enablers as an approach to qualitative research before. So I can't wait to hear what they both have to say. So keep any questions in mind. You can pop them in the chat and we'll get to them afterwards, or you can ask questions afterwards. So I'll facilitate that process there. But Victoria, if you'd like to get started.
Thanks so much, Catherine. And Abby and I have been writing a paper about this. So as Catherine said, I think a lot of people use the barriers and enablers approach. And we certainly want to just have this as a generative discussion and just to think a little bit differently about the ideas. So we really welcome people's thoughts because we're still working it out ourselves a bit. Thanks, Abby. Yeah. We'd also like to acknowledge the traditional owners. For me, that is Gadigal land.
And Gadigal land for me too.
Yeah, next slide, please. So I just wanted to talk a little bit about how we came to this idea of a critique of barriers and enablers. For anybody who's met me, you probably know that I'm an anthropologist, and I did my PhD in anthropology around the topic of sex selection, which drew me into sort of debates around feminist ethics and people who are critiquing the idea of dichotomous thinking. And I sort of think about barriers and enablers as a dichotomy. So some of these dichotomies involve things like man, woman, reason, emotion, mind, body. And you can see here on the screen, this book, Rational Woman, is sort of playing with this dichotomy because, of course, women are often labelled as emotional or overly sort of passionate, whereas the sort of masculine is labelled as the rational. So I guess what these feminists were sort of saying was that this way of thinking, it kind of elevates one part of the dichotomy at the expense of the other. And I think it creates blind spots as well. So what we're trying to do with this discussion of barriers and enablers is just to perhaps sort of turn our heads and just check our blind spot and just see if there are things that we might be overlooking in thinking with this dichotomy. And I'll pass you over to Abby now.
Thanks, Victoria, and thanks everyone for the opportunity to talk with you about this topic today. So I also wanted to tell you about how the seed was sown for me on this topic. It was many years ago when I was conducting a largely qualitative process evaluation of an intervention aimed at increasing policymakers' use of research. So I was asked to unpack the barriers and enablers to engagement with the intervention and with research utilisation more broadly. And in one of my first interviews, I rather naively asked a senior policymaker something along the lines of, what are some of the challenges you find in accessing and using research in your work? And he said, why would I want to access or use academic research? So we had just assumed these policymakers either wanted to use research, i.e. the stuff we were producing, more effectively in their work, or at the very least, they wanted to be seen to be doing it. But what I actually found was what many of you here today know all too well, was that these policymakers were already engaged in highly sophisticated, complex processes of knowledge creation. They were involving stakeholder consultation, co-production, information gathering from a wide range of sources. They really valued real-world information that had social credibility, and they valued academic insight where it could draw on a body of knowledge and present it in an action-orientated way. They were commissioning research, but they weren't generally searching for existing academic papers that were unlikely to be addressing policy relevant questions. So asking about barriers and enablers didn't make sense in the context of this study. This approach assumed that there was some kind of shared vision of a desirable outcome over there that policymakers could reach if only we could identify and tackle the things that are getting in the way, or tackle the things that were helping. But policymakers not only rejected the way that we framed this idealized outcome, they were also questioning the basic concepts that we were using to describe their behavior. What do you mean by evidence? What do you mean by using research? So I mean, I guess you could say that a barrier to engaging in the intervention was that they rejected its premise, but that hardly does justice to what was going on, right? It doesn't help us understand it, and it doesn't provide rich information that helps us critique the intervention design and the premise. So I'm always hesitant now when I see a barriers and enablers paper, particularly if it's tackling complex context-dependent processes in complex systems. And we'll talk a little bit more about that as we go. But it's hard to ignore the fact that barriers and enablers are currently very fashionable in health research, as this Scopus search indicates, and it seems to be used almost as a default approach. So Victoria and I are arguing that it shouldn't be a default, that and alternative ways of dealing with research questions and research problems, or of strengthening the barriers and enablers approach, should be considered where they might shed more light on the research topic. Joseph Maxwell identifies 4 pitfalls in developing qualitative research questions. He says they can be too broad or vague to provide meaningful direction, or they can be so specific they create tunnel vision, which neglects important conceptual and practical aspects of the phenomenon. Research questions can also be loaded with unexamined assumptions, which they end up kind of smuggling into the research design, or they may simply be developed in response to perceived scientific or strategic norms that don't really serve the underlying research goals. We think that research questions that are framed as an investigation into barriers and enablers can suffer all these pitfalls. Essentially, the barriers and enablers approach is asking what's getting in the way of this desired behaviour and what's assisting it, with the aim of generating lists of those things, but often with very little in-depth analysis that explains what those things are, how they function, or how they relate to each other. So this approach is very abstract, right? And it's too broad to offer any kind of sound conceptual guidance. Yet the barriers and enablers framing gives the impression of a conceptual framework. So it ends up creating that tunnel vision because researchers aren't engaged in critical thinking or exploring other ways of seeing or exploring the phenomenon. The barriers and enablers approach is also untheorized. It's a framing device that sits at best on some kind of vague ideas from behavioural science, or maybe it's just a pathway metaphor of obstacles and supports, rather like a game of snakes and ladders. But none of this is articulated explicitly, so there's a real danger of smuggling in unexamined assumptions. Yet because it's familiar with all the apparent attributes of common sense, it's chosen as a safe approach by many researchers, including those who seek ways of making qualitative research appear more palatable to reviewers, funders, and potentially our quantitatively orientated colleagues who are just used to it. We're arguing that the barriers and enablers approach bypasses critical thinking about research design and about targeting the behaviours, interventions and implementation strategies that are often the focus of our research. And consequently, it can produce shallow research findings that neglect context and complexity. And Victoria is going to pick up on some of those ideas now and explore them in some more depth.
Thanks, Abby. So I'm going to talk about, I suppose, how when we're doing analysis and interpretation of qualitative research, what is the strength of qualitative work? Got a quote here from Pope and Mays, who are critically reflecting on qualitative research. And they say everyone thinks they can do qualitative research now. Those papers that report 6 themes and they don't explain what the relationship is between the themes, they don't really go in anywhere in terms of trying to explain the data. A real strength of qualitative research is induction, interpreting the data. That's where you find the unexpected. I sometimes worry that we don't push qualitative research far enough. I'd like it to be less descriptive and for us to try harder at explaining things. So that just points out some of the key sort of strengths that we're thinking of when we think of qualitative research. Next slide, please. And so when it comes to barriers and enablers, we're arguing that they tend to generate a list of good and bad things, and it's often a similar list of things like funding, communication, social support, awareness, motivation, time. And the problem is that a lot of these themes don't necessarily have a causal link to one another, or they don't have a kind of a relationship either. So what we're arguing is that we really need to think in terms of how the themes are possibly connected, what are factors that are interrelated, and how do they tack off one another. So the barriers and enablers approach, it doesn't really wrestle with explanation or causality, what causes something to become a barrier and enabler. And it often is also just taken at face value. So people might list something as a barrier, but it doesn't really, just simply presenting it as that doesn't really get beneath the surface of that, why that person is saying that particular thing. So the next quote, which is on the next slide, is from the same article, and they're talking about GPs and the use of clinical guidelines in their practice, or the lack thereof. So when they're thinking about, what are the implementation barriers to using clinical guidelines in practice, GPs were often listing lack of time as a barrier. However, as they say here, their accounts could not be understood literally. Instead, they related to GPs' underlying beliefs about how work should be allocated in general practice and what it meant to be a GP. The things that stopped them from implementing the guidelines actually had little to do with information management and shortage of time, but those were the reasons that they had given to the interviewers. So it's just, again, thinking about if simply listing something as a barrier really can stop us from going beneath the surface of that explanation, because it sort of, it just stops there as a barrier. And we're arguing that we really need to dig deeper into, what that statement means. Instead of just agreeing with whatever's been said to us, we want to interpret it. I'm not going to read all these because I don't want to spend too much time, but this is just a list of sort of some of the common ways that barriers and facilitators or barriers and enablers are kind of talked about in the literature. I'll just give you a minute to look over that. Things like knowledge, skills, behaviour, social context, organisational culture. They're very broad things, very high level, and don't really take us deeper into the explanatory territory that we're saying is the strength of qualitative research. We'll move on to the next slide. And as Abby was saying initially, that it really, when we're dealing with complex issues, the barriers and enablers approach is possibly something to really be wary of. It's not necessarily wrong, but it really requires a lot of thought about whether it's appropriate in the complex context that you might find yourself in. So what we're saying is that they focus on the here and now, and they neglect broader context, history and social processes. And it was funny, I was at the physio this week, and it's like this physio where people go often after childbirth and things, because they treat sort of pelvic issues, and I noticed that they've got all these things built into the clinic, which is, I was thinking, they're trying to reduce barriers for women to attend, like they have a creche to look after the baby, so you can, they have mums and bubs classes so that you can go and do exercise with your baby on the mat. They had little signs how if you wanted to heat up your milk, you could do that there. And so, in that sort of simple, straightforward context of the clinic, these barriers were quite easily identified, and they'd been thinking nicely about how could we make it easier for women to come. But then I thought about if you move that clinic to, you know, another region where possibly in regional New South Wales, not in Sydney, where, you know, people have to travel long distances, or possibly even in a place where, you know, that people's work just did not allow them to take time to go and visit the clinic. You know, if you shift that context to anything slightly more complicated, those barriers, you know, it suddenly start to seem like just they're the low-hanging fruit, but they're much bigger things going on. And I think sometimes the appeal of this barriers and enablers approach is that it can seem to present a simple solution to really complex scenarios, and that's a nice idea, that we might be able to do something simple. But the issue is that many of the problems that we're dealing with are wicked. So they're characterised by emergence, uncertainty, and change. But when you treat something as a static problem and suggest universally sort of applied best practice solutions, then it kind of it sort of sets you up for as a false friend, as we're calling it. It's not going to really lead you to the kinds of changes that are possibly needed for the complex situation. Next slide, please. And I've done a fair bit of work in implementation science, where they're often addressing things like contextual barriers and facilitators to try and enhance the take-up of interventions and things. But the issue is that this is a model of research which is about a linear kind of change, where contexts are kind of the sources of obstruction for that intervention to take place. But if we go to the next slide, as Trish Greenhalgh makes the point, context and confounders or contextual barriers, they're at the very heart of an innovation or the implementation of an intervention. So they're not separate, they're not extraneous to the object of which we're studying. They're an integral part of it, and there are multiple and unpredictable interactions that come from different contexts. And that's the kind of thing that determines the success or failure of a dissemination initiative. Next slide, yeah. So back to my original sort of statement about this binary thinking and dichotomies. Barriers and enablers suggest a binary framework, but they're not a reality. So we want to think about whether something might be a barrier and an enabler. And is a barrier always a barrier in all contexts for all people in every circumstance? In some cases, contextual factors that are barriers in one place might be a facilitator when you move the intervention to another place. And this just underscores the fact that contexts are dynamic. So just like we can adapt interventions to local contexts, interventions can also reshape contexts. And I thought I might give a little, on the next slide, an example from my research. So this was a study where we were looking at funding in Tasmania, and we were kind of, the funding had been given to a whole lot of prevention programs at the very beginning of 2020. So when we did the research in, I think it was May 2020, everyone was in lockdown. So these prevention programs had been given all this money to do these wonderful things in food and nutrition and health, physical activity, smoking cessation, and suddenly they found themselves in the midst of a COVID lockdown. So rather than sort of, you know, just doing the research as planned, we decided to talk to people about how COVID had been affecting or the programs essentially, and what had been happening. And we could have taken a barriers and enablers approach, you know, how, you know, what are the barriers and facilitators that have happened with this intervention? But instead we just kind of gathered their stories about what was happening for them. And this was one of my favourites, because this food box program had been planning to build up over 2 years to deliver 30 boxes a week to sort of a region in Tasmania. But within a fortnight of lockdown, they were delivering 60 boxes a week, and they'd covered a broader footprint than they'd originally planned. And some of the things that they'd done to make this possible, one of the big music festivals hadn't been able to happen during COVID. And so they basically used that music festival site, and they employed the staff who were supposed to be working on the music festival to build the food boxes. They used the big tent. And so they were essentially, well, they were providing work to people who would have otherwise been out of work, but they were also making new connections outside of the food system. And that was kind of facilitating them to be able to reach a bigger area and serve people, you know, during a time when they otherwise might not have been able to get enough food, all while serving healthy things in those food boxes. And so it was just a beautiful example, I think, of how, you know, a crisis or a potentially massive contextual barrier like COVID lockdown was actually transformed by the intervention into something which was quite remarkable, and nobody would have expected them to scale in that way. So it's just the way that the context itself was shaped by the intervention, as well as the intervention being flexible enough to adapt to the circumstances in which it found itself. So I think that's just trying to give a little bit of a different picture of, you know, what we might do instead of thinking just in terms of barriers and enablers. But Abby's going to keep talking about some other ideas about alternatives and enhancements.
Yes, thanks. Yes, one of the things we wanted to do today and in our paper is remind people that there are many, many alternatives to a barriers and enablers approach that can guide research questions and research design. But importantly, most of these alternatives can also accommodate an exploration of barriers and enablers within a more robust conceptual framework. So one alternative, of course, is to take an inductive approach, thematic analysis, grounded theory, qualitative description, where you identify key concepts in the data and you use those to structure your findings. But we suspect that researchers often opt for the barriers and enablers approach because they feel the need for some kind of conceptual or methodological or just plain pragmatic scaffolding to structure their inquiry, including how they conduct the analysis and how they report on the findings. We also suspect that many people will always default to a barriers and enablers approach because it's, as we were saying before, it feels safe, it's familiar, has face validity with some of our colleagues, particularly more quantitatively leaning, and potentially funders. So what I'm going to focus on now is a range of strategies for enhancing a barriers and enablers approach. So one way this can be done is by exploring barriers and enablers within an established methodology, which has its own philosophical framework as well as established methods. Examples of this are phenomenology, realist evaluation, soft systems methodology, arguably many case study analysis approaches, ethnography, and others. These methodologies provide a kind of conceptual background, but they're flexible enough to also address barriers and enablers. And there are interesting examples in the literature of this kind of hybrid approach. So Huntington et al. Here explored barriers and enablers using grounded theory, and they built a conceptual model that describes the process of sexual adjustment to HIV, and they identified intervention points for providing support. Erdem et al. Conducted an interpretive phenomenological study exploring barriers and enablers associated with male mental health help seeking, and they developed an in-depth understanding which included themes such as denial as preservation. So you can already hear there's a richer analytical approach going on there than you typically get in a barriers and enablers approach. And Singh et al. Are using realist synthesis to examine barriers and enablers to walking programs with the aim of developing program theory, which explains how context mediates mechanisms to produce outcomes, which is the typical realist mode. Formal theories, conceptual frameworks, and sensitizing ideas can provide invaluable scaffolding about where to look and also how to think about what you find. So they can help researchers explore the nature of and relationships between barriers and enablers in their data and think more critically about them. So some of these include, I'm not even going to get into what's a framework, what's a theory, but just throwing them all in one basket, they may include socio-ecological models, systems thinking, normalization process theory, self-determination theory, social cognitive theory, the trans-theoretical model, structuration theory, etc., etc. And there are many well-established frameworks for health services research, for synthesis, and particularly for implementation. And when it comes to implementation, as Victoria's already suggested, we would strongly encourage you to engage with the more recent developments in the literature that have moved away from a programmatic focus on fidelity, where the aim is to develop the same thing in all contexts and then ask what the barriers and enablers are to that process, but rather to embrace methods that help you understand how interventions are championed, adapted, and inevitably reinterpreted in different contexts, and how interventions can be strengthened by local adaptation rather than weakened. So Victoria has already written about this, Penny Hawes, the guru, and others have picked up and run with Penny's work. As we've said, theories, conceptual frameworks, and sensitizing ideas provide a different or enhanced way of paying attention to phenomena and thinking about what you're seeing. Research that is sensitive to different ways of seeing will produce different findings. So, for example, as this image suggests, a study of barriers and enablers to physical activity experienced by children with disability will produce different findings if it's informed by the social model of disability, in which environments are regarded as enabling or disabling, rather than a medical model of disability, which focuses on individuals' impairments. Critical perspectives which attend to structural inequities and power-based features have a particular value in challenging those smuggled-in assumptions and in revealing systemic barriers. So, for example, the authors of a study of obesity in Cuba and Samoa, they rejected the traditional focus on barriers to weight management because they argue that this focus can be harmful. It's conflated different classes of phenomena, and it's compounded stigma and disempowerment because of this assumption that once barriers are identified, they should be surmountable, and when they're not surmounted, individuals are to blame. So instead, they used a concept or a sensitizing idea of social visibility, and they used that as an analytic lens to critique the failure of most obese.
I think Abby may be frozen.
I'm frozen?
You're back.
Oh, good. And if we want to really understand stakeholders' points of view and we want our research to be used by them, then we probably should consider participatory methods of research. So an example of this is Loblay et al. And their exploration of barriers and enablers to social inclusion of people with disabilities. They used a photo voice methodology to develop themes such as the paradox of accessibility, which examines conflicting needs. And we can also choose to advance existing work on barriers and enablers rather than starting from scratch to produce yet more descriptive research, which finds pretty much the same things again and again. Do we really need more studies that tell us that information alone is seldom a catalyst for change, or that people are more inclined to exercise if it's enjoyable, or that health professionals struggle to perform everything that's asked of them optimally due to lack of time? So we can advance existing work by investigating how an already well-established barrier or enabler works in depth. Just going back to that example of time that Victoria explored earlier, this is the most commonly cited barrier to implementing interventions in organisational settings, such as hospitals. Findings typically report a lack of capacity by staff to take on anything new, but they seldom critically examine this. There may be numerous structural, systemic, cultural, or individual factors underlying this experience of lack of time, which are not volunteered or possibly even perceived by some participants. What if, for example, the rush culture in the hospital has convinced staff that hospitals are appropriate sites for treatment, but not health promotion? What if staff feel they need to be seen to be working at capacity, irrespective of ebbs and flows in their practice, if they're going to hold on to their jobs? What if the underlying problem is burnout or compassion fatigue or deep resentment at how you're treated and you feel taken for granted as a member of staff, but it's too hard to say those things? So the concept of time, as with many other barriers and enablers, might better be understood not only in terms of present or absence or good or bad, but as the point of departure for further analysis. Second, we can develop and test implementation strategies for addressing barriers and enablers that have already been established. So Thompson and Reeve here in this quote are making the case for that in relation to deprescribing research. They're arguing that we need to start, the literature is already full of information about what the barriers and enablers to deprescribing are, but what we need to start doing now is do something about them. And lastly, the existing barriers and enablers literature can be used to develop a more formal theory about what's going on. So Herber and all developed a new theoretical model to explain heart failure self-care based on a metasynthesis of reported barriers and enablers. While Noyes et al. Developed a model for reconceptualizing children's complex discharge. So they drew on a synthesis of barriers and enablers, and they integrated that with existing theory. So I think we're done talking at you. I'm going to pass the baton back to Catherine for the discussion, but I did just want to say that Victoria and I, as she mentioned, we're still feeling our way through this. We're very keen to know what you think, especially whether you're convinced that a barriers and enablers approach shouldn't be a default approach. If you think we've made a compelling argument, if we've missed any critical aspects of it, and if you think we've presented some useful ideas about alternatives and enhancements. And I did just want to own, before I hand the baton back, that I too have used barriers and enablers approaches, and I probably will in the future.
Thank you,
I stopped
Abby.
sharing.
Yeah, thank you for sharing the load there. We probably all have done that actually at some point in our careers. That was fantastic. I really enjoyed that. Really good food for thought and making me think a lot about different issues. So for everyone listening, if you've got any questions, feel free to pop it in the chat. I can see one there already, but while you're thinking, I just wanted to sneak one of my questions in. I was wondering, Abby, if you could speak a little bit more about the sensitizing ideas. I thought that was an interesting concept. Could you explain just touch a little bit more on what they are and how you incorporate them?
Well, I'd open that up to the rest of the group here. I'm sure other people have their take on that, but for me, it's theory light. It's a critical idea or lens or way of seeing the world. It doesn't necessarily have to have a whole program or middle range theory built around it, but it's just a way of helping you think about what's going on out there. Part of the problem with the barriers and enablers approach, and I think it's come from the positivist paradigm, is that it's kind of assuming you can be objective. And I think the sensitizing idea is an acknowledgement that no, you do have ideas about how the world works. You have ideas about ontology, about epistemology. Let's just name them. Let's just make that transparent. And the sensitizing idea is just a way of helping you think about what you're seeing and shining a particular light on it.
Yeah, fantastic. Thank you. All right, we've got a question. Peter McHugh popped this in the chat very early on in the talk. Maybe, Victoria, you want to approach this one. He said, any thoughts about qualitative versus quantitative dichotomies? And I'm wondering if this is purely in relation to barriers and enablers or just generally.
It's funny you should ask that, Peter, because I think as I was sort of rehearsing this in my head, I thought, oh, we qual researchers quite like to dichotomize the qual and the quant, and we put everything in its own boxes. And I guess there would be an argument for, what kind of blind spots that leads to. But I think there's also an issue around paradigms and sort of, I think within qual and quant, you have sort of a range of different paradigms potentially. And I think that if we unpack it a little bit, that there are sort of different ways of doing each of those things. So in general, as an anthropologist, I've always been discouraged from just letting a dichotomy kind of wash over me without thinking about it. And I think that the point is not that they aren't sometimes useful to think with, because they are, and they help us kind of connect with other people. And that sometimes we want intellectual shortcuts to just not have to explain everything. But we don't want to uncritically think with them. So we do want to question them, and we do want to, continually ask about what is that relationship between the qual and the quant, and how do they come together, and they can come together in lots of different ways. I'm not sure if I've done justice to your question, but that's just a little spring of thought.
No, thank you, Victoria. And what I'm thinking in particular about is a couple of comments that you made throughout your presentation about funding, funding prejudices towards quantitative methods, also quantitative researchers then spilling over to quantitative methods and not perhaps understanding that theoretical framework that's required, and then going ahead and trying to do that work without understanding what some sort of collaboration with qualitative researchers would kind of identify some of the issues that you've highlighted.
I think that's a great point. Yeah.
Thank you.
Great. Thanks, Peter. The next comment or question is from Troy Walker. He's saying thank you very much. And the idea of a smuggled in assumption is a great point. About a couple of examples come to mind. One is terminology within qualitative research having presumed definitions when multiple researchers or clinicians would give you different individual responses. And two, there seems to be a smuggled assumption that an acknowledgement of country before every presentation in the university setting is what's being asked by community members when there aren't always necessary if you were to ask Aboriginal people. Abby, would you like to respond to that one?
And I'd value Troy expanding on that a little bit more. What was the first one again?
Have you
Presumed
got the
definitions.
chat, Abby?
Can you see it in the chat?
Sorry, I'm a Teams non-expert.
Troy, if you wanted to unmute and share a little more on this comment, that would be fantastic.
That would be good. I would just say about the definitions. I mean, I think it's incumbent on us to define our terms when and that's one of the ways that we can work more transparently. And I was not aware that members of Aboriginal community were unhappy about, and I'm distressed to hear about Welcome to Country.
No, thanks, Abby. Oh, good. I think the smuggled in assumption was just a really good framing for how things can be thought about in a qualitative context. And I wouldn't by any means call myself expert in qualitative research, despite a few things that I've done in the space. And I agree with what I think Peter had mentioned before about quant getting some odd sense of precedence over qual as well for some weird reason. But when I was mentioning smuggled in assumptions, I was thinking about it from the second point more came to mind from the sense that we do the ideas of assuming in qual research we'll typically use terminology, as you'd mentioned before, Abby, that it has a presupposition that everyone knows what the term means. And oftentimes, if you ask 10 different people in the room, you get 10 different answers. So that's where I was coming from with that particular perspective. And then I just had another thought thinking it through, because typically speaking, in any university-based introductions, it's commonplace, almost compulsory. It seems. I haven't seen any where there hasn't not nowadays been an acknowledgement of country. This is, but at the same time, or a welcome if there's an elder present or someone that's welcoming us in, but typically an acknowledgement. But there's again probably a presupposition that that's just what you do, but it doesn't inherently resonate with every Aboriginal person that I've worked with. So that's kind of where I was coming in with the use of smuggling assumptions with that idea. But more so from the qual perspective was just seeing that it was really good. I think Victoria mentioned about how we'll have it's looking at the intricacies between themes almost, and how important it is to look into the substance of those things. But a lot of the times I tend to find from what I've read, the substance of those things comes from definitions in themes that we presume are what everyone agrees upon, especially when you're working with a team. And it's really cool because, in some regards, you get so much creativity and openness of thought. But in many respects, you can't fine tune it into something really specific. so that we can all kind of, in a sense, not be totally agreed upon, but at least have a consensus where it gives us something to build upon for this next set of theories that might work thereafter.
That's a great point.
Thank you, Troy, for expanding on
Thanks.
that. I don't know,
Yes.
Victoria or Abby, if you had any more to add to what Troy said. No? No? Okay. Thanks again, Troy. We've got some more comments in the chat, and feel free to add any more. We've got one from Teppy McLaughlin. He's saying thank you for the presentations, and that he explains that they wrote a grant and they said that they do barriers and Teppy, would you like to share it, Teppy?
Yeah, can do. Yeah. We wrote that we would do barriers enablers, probably aligned to that idea that we thought it would get over the line with the grant, and it's a very quantitative focused team, so that kind of fit in nicely. But I suppose the challenge is that the process evaluation is seen as the afterthought to the rest of the stuff going on, and that particular piece, the qualitative piece, is seen as the afterthought to that. So I suppose there's very limited time to convince people otherwise, and so I just wondered what your top 3 things that you would say in a 30-second pitch in a meeting to try and convince somebody, which might be different to your whole presentation there, which I think really explained why. But yeah, kind of the most persuasive arguments is probably what I'm getting at.
I feel your pain. I don't know if I've got any persuasive arguments, because I would do exactly the same thing in a grant application. And then when I said I will be using barriers and enablers again, that's what I meant. It's I'm often brought in as the qualitative person on a intervention trial grant application, and I often have one sentence where I can say we'll explore acceptability, feasibility, barriers and enablers. That's just strategic. Victoria, do you have ideas about how you might pitch a different way of thinking to your team?
I probably wouldn't pitch it at the outset. I think I'd go along with it. I'd say yes, okay. Do my qualitative research in the best way I could, which means probably not directly asking people about barriers and enablers, but rather speaking to them about what matters to them. And then, I think there's an element of sort of having to give people what they expect and then being able to show them how it's more complex. So do your analysis, do your interviews and things in a way that you feel good about. Yes, you can draw out those things in the analysis if people want to see them, because you're always going to have to do that if this is the frame you're working within. But then you can show, you can just as we've done in a few examples here, you can do it in a richer way. I think the best way to critique things is with examples, personally. So I would do it and then show why that's, then you can just blow it all. No. But yeah, just showing people that there's another way of thinking, that you need to have the data to do, I think, if that's a really strong thing that they're thinking with.
Yeah, so just to add on to what I was saying before, I would usually tend to say, if we want to know how and why things unfold the way we do, we need to ask in-depth questions.
Yeah, brilliant. Thank you. That's really helpful.
Great. Okay, now we're moving on to more of a technical question. Babatunde is asking, could the use of software such as NVivo enable us to overcome the challenge of viewing research from the barrier-enable lens in qualitative analysis? Can those software tools help?
Shall I go?
Yes, you go, Abby.
NVivo is a data management tool. You can conduct analysis of many different types using it. So there's nothing inherent about NVivo that is, dare I say it, a barrier or an enabler to your research analysis. It's really how you use it. So, I mean, if you do a framework analysis in NVivo and you have 2 columns, one's barriers, one's enablers, that's all you're going to get. If you do a inductive analysis where you're thinking more broadly, you're trying to let the data tell you what's happening, or you bring in a conceptual framework, or you're working with a theory, it'll look very different in terms of your coding. So yeah, that would be my take on that. What do you think, Victoria?
I suppose it's only useful to me in so far as I would be hesitant to create codes that say barriers and enablers, unless, as we were just speaking about in the previous question, that you do need to just document that for other people, not necessarily yourself. So yeah, I think that in that sense, it can be a way, like maybe resisting coding with that framework as your primary kind of way of organizing your data. So you could use it as a self-checking thing, that you're not just going down the easy path, and that would be the only way that I could see it. Yeah, just as what not to do, basically. Don't code barriers and enablers unless it's for a very kind of transactional kind of thing.
Okay, great. We have got it's more of a comment from Penny Love. She's saying that her research focuses at the I just dropped it down, the implementation at a service level. So she finds organisational readiness as a good way to frame the questions about what's helping or hindering implementation of something. How do you feel? Do you think that could be a good approach? Victoria, any thoughts?
Sorry, I've lost the question.
I know it just got moved up.
Yeah, I think the helping hindering is probably another way of saying barriers and enablers to me. But it's not to say that it can't be in there at a different. I think Abby and I presented this a little while back to her qual group, and we had a whole discussion about which stage you bring in the concept of barriers and enablers, and that, you know, if it's later on after you've done a lot of analysis and used theory and things, that, you know, those concepts of helping and hindering aren't bad to bring in. I think public health love these. They love the pros and cons and the help, and it was, I guess that's just the thing that struck me so much when I first started working. I was like, why is everything in these boxes? It was very strange to me. So people like that, and I think that it can be, you know, used in the right way, then it's not a bad thing.
Great. Next comment's from Anne, and Anne, I think you should probably share this rant with everyone.
Well, I was just saying thanks for doing the topic, because anyone that's been near me lately knows that this is one of my rants. And my other rant is around the domain summary versus thematic analysis. And I too, confession, I actually had a look at my CV and I thought, I'm just going to do a search whether I've got barriers and enablers. And my most recent publication has that. I didn't do the analysis, let me say, and I did try and push back. But anyway, yeah, and I think that it'd be interesting to know what you think, but there's a bit of crossover there, that the barriers and enablers has this problem of being limiting, and sort of you end up with this list of unintegrated stuff, as you do with a domain summary. And just for those who might be familiar with that term, the domain summary is what Braun and Clark talk about as it's kind of those face validity type codes that you do that you don't really develop and are more interpretive, and they're the kind of things like barriers and enablers that you would know without even doing the research. So you could pick those out prior, and it's kind of, I thought that was a really nice way that they described of kind of knowing that you're heading down that track. It's what you might have known prior to actually doing the research, rather than going into your data and feeling what comes out. And I had my sort of epiphany was a study where we were looking at the implementations of sit-stand desks in an office, and that sort of lent itself to this, what are the barriers and enablers to using them? But when I went in, I realised actually a more useful way of thinking about it was actually the trajectory that people go on when they're introduced to a office and what's their starting point? Are they interested in them in the first place, or are they completely uninterested? So was a different way of thinking about it, and those barriers and enablers were sort of sprinkled in there in the recommendations we gave, but it wasn't a good way of sort of wrapping up what was going on. And that's when I sort of thought, oh yeah, now I can really feel that difference. But I'm interested to know what you think about that crossover that I mentioned.
How did you develop that that insight, and that the sort of like this journey towards the desk and its use was going to be a more useful approach? Was that derived from talking to people there?
Oh yeah, so we were
Right.
doing the interviews. I mean, partly, you know, that's the other danger that you go to. The way that I did the narratives, you just get people to talk you through, well, what happened and how the order of things. So in some ways, a trajectory is kind of falls out of that. But it really did seem to me that people had a certain starting point, and that really shaped what track they went down to and what sort of happened in the context of the office. They would see someone else using, if they were kind of agnostic, they might see someone else in the office using one, and that sort of started their journey, as it were. So just thinking about those trajectories was more through the way that people talk through their experience.
It's just an interesting example of how you developed a kind of a broad conceptual framework for how you can approach it, only at the point where you were already in there talking to people. It wasn't something that you brought a priori as an idea. And that goes back to what you're saying about domain summary. Am I just going to be exploring stuff I already know I'm going to find? Yeah, and we do a lot of that. And I think barriers and enablers definitely is that's one of its big downsides. Yeah, it's not only yet more descriptive research, it's the same descriptions.
Victoria, did you want to add? Oh, sorry, Anne, you go.
I was just going to say, yes, and that was another thing. The more, because I was working in the area of chronic disease prevention, that model was continually used. It was always the same reasons. And I thought, well, where's that going? Where's that going in terms of finding solutions? What do we make people have more time, or giving them more motivation? So the things that they were coming up with weren't things that were really amenable to, well, how are we going to actually change these? Because it's the context that mattered more. Sorry, yes, Victoria?
I guess I was going to say that I think thematic analysis, if done well, would hold this sort of contrast, but I think that thematic analysis can sort of slip into a collect, it can easily just be theme without, the same thing of not really thinking about the relationship between the two. And I realise that's not the way that Braun and Clark have, encouraged people to go about it, but it's sort of, yeah, and I think a lot of this comes back to perhaps the confidence of the researcher and their level of familiarity with qualitative research, and sort of feeling like you need to have something safe to hold on to because you're not really sure what you're doing, and that if you just have something that feels safe and that will make it all right. I think it's perhaps about encouraging people to have that confidence to do what you described, and of sort of observing what's going on rather than coming in with an idea of what you want to look for, and letting that guide your analysis. And I think that's, yeah, it's sort of having the courage to do that, which is, especially if you've come from a quantitative background, and we've talked about that dichotomy, but I think if you've been trained in a particular way of thinking about research, it is hard to let go of that and think about doing something quite different, where you just go in and look for, explore and see what's going to happen.
Yeah, and that interpretive leap that we're talking about in analysis is often feels like bias, doesn't it, to people who come from that quantitative disciplines. And it's a really hard, it's a paradigm shift. It's a really hard thing to shift on, to see the world through that different lens, the interpretive lens.
Yeah, fantastic. I think this is just a great conversation. We've also had a fantastic item in the chat from Fiona Robards, and she explained how she was funded by the ministry to explore barriers and enablers to young people accessing healthcare with a focus on marginalised groups, but then realised that that approach just didn't work for that group. And so she used grounded theory and found that young people were ambivalent about healthcare access because they're often weighing up different factors like quality versus cost, efficiency versus appealing care. So that there was seldom a perfect solution to their healthcare needs. So I think that's a lovely example, Fiona, and Fiona's actually put her paper in the chat if anyone wants to grab that there. And then Penny, I think we've got time for one final question here. Question for Victoria. What are your thoughts about using a framework a priori such as CFIR when doing implementation research?
Oh, thank you, Penny. I am not a framework person, so I'm an ethnographer, which is maybe a framework, but yeah, maybe I actually like when I've worked with them, I think what's good is that it can alert you to think about things that you might not have thought about naturally. So it can just sometimes broaden your thinking, but I would never start out with one, but that's just because my research training doesn't lend itself to that. It's not that I think that's not a great way of doing things. Abby, do you work with frameworks?
Yeah, particularly in a grant application, it can be a very helpful thing to do to really pin your research to something that I think people often feel more confident about your work plan if it's attached to a well-established framework. But you know, CFIR, it's really all it's saying is like Victoria was saying, pay attention to these domains, pay attention to the inner context, pay attention to the outer context. There's a lot of scope there for you to ask questions about what's going on in those contexts and how do they relate to each other? Is the relationship between these different attributes nested? Are they bouncing off? Is it causal in one direction? Is it bidirectional? To think about all those, there's a lot of scope. Yeah.
Fantastic. We are going to have to, unfortunately, bring this fantastic seminar to a close. I'd like to thank our wonderful speakers, Abby and Victoria, and I'd also like to thank the Prevention Centre. I'm sorry I didn't flag them at the front. They are hosting this, and they've the reason that we're here today with this community of practice. And can I thank everyone who's participated in the conversations, in the chat. It's been wonderful. It's so much food for thought. I am definitely going to be thinking about some of these issues you've raised today. Thanks again, Abby and Victoria, and thank you all.
Thanks, everyone.
Thank you, Catherine, for coming on holiday.